that much time. So the question is, how is the pandemic affecting mental health of child and adolescents? Next slide. To give you an overview of the potential effects the pandemic is having, or via which aspects the pandemic is having effects on mental health, I just want to discuss the following issues. Obviously, you know of school closures, online schooling, social distancing, social restrictions, fear of infection for some of the youth, sequelae of infection of self or others, and lack of recreational activities outside of home. Then there's an issue of parental stress, but also potentially abuse and domestic violence. Now we can also, next slide, look at the effects the pandemic is having on child and adolescent psychiatry, which I think is also important to at least have a brief focus on. So at least last year, but also partially this year, we've had units closed in our hospital. The communication with families is hampered. Families, for instance, are also not allowed into the hospital. So the exchange between patients, inpatients and families is also reduced. There's an increased workload, stress for employees. There is a risk of burnout. There are some publications on mental health care workers risking burnout. Increased organizational demands and novel technology, in particular telepsychiatry. I struggled with that this morning. So next slide. I just want to briefly point out the column in red. This is our own department, our own acute ward. And what we saw is that we're having an increased number of emergency referrals, which started in the fourth quarter of 2020. You can see the number 97 lighting up in red, and for the first quarter of 2021, it's 117. So we have increases of 39% and 67% in the last quarter of 2020 and first quarter of 2021. As compared to all the previous quarters, the mean of all the previous quarters. So indicating that, yes, we are seeing many more emergency referrals. Most of these suicidal ideation, suicide due to suicidal crises. And the age range is, I think, very narrow. It's around, according at least to our data, it's between 13 and 15 years of age. These kids make up the most out of these emergency referrals. Next. So to proceed with the study that Dimitri was referring to, we have had a survey amongst academic heads of child and adolescent psychiatric departments in Europe. The first survey was conducted last year, between March and April 2020, and the second one was conducted early this year. And the heads were invited to complete a self-report online questionnaire survey. We had for the first stage back in the spring of last year, we had a substantial reduction in the number of both outpatient visits and hospital admissions. We found that the heads of departments thought that the pandemic had a moderate effect on psychopathology, but profound effects on the organization of child and adolescent psychiatric services, including, obviously, the novel technologies, including telepsychiatry. Next. So for March, April 2021, the survey was sent out to 266 heads of university services in 32 countries. The response rate was 27.1%, and 60 filled in the questionnaire completely. So obviously the response rate was lower than in the first survey, just about half of that in the first survey. So I assume that people or the heads of departments are not as willing to fill in a questionnaire now as they were a year ago. The COVID-19 pandemic was novel at the time. Now everybody is receiving so many questionnaires that it's hard to really keep up with them. And a total of 22 heads out of 22 countries responded. The highest rate coming from Germany, and we had some countries from whom we did not hear at all, unfortunately. Next. So what this slide is showing you is that the impact, which was in green, is the last survey, and in blue, the current survey, so just about a year apart, that the impact is perceived to be much more strong this time around as compared to last year, with a large proportion of the respondents stating that it has a strong or even extreme effect. Next. Now, there's also a substantial increase in referrals for diverse disorders and problem behaviors in comparison with early 2020. I just want to point out 4 disorders, problem behaviors that have really skyrocketed. One is anxiety disorders. The other is depression. The third is eating disorders. We are really being flooded with patients with anorexia nervosa. And the last one is, as already mentioned, are suicidal crises, which have also skyrocketed in the second, or been rated as occurring much more frequently in the second survey. So beginning spring this year. Next slide. The influence on psychopathology was perceived less a year ago and has now increased. So this would potentially also include that the pandemic, for instance, has led to increased obsessions and compulsions related to fear of contamination, for instance, would be one example of such an effect. Next. Now, the determinants with the greatest impact differ according to the age range. And if you look at the younger age range, for instance, parental stress. So if the parents are under stress, this is perceived to be a much stronger, or a stronger issue in younger children, whereas, for instance, social restrictions are perceived to be of a greater impact for the older age group. Next. So now to come to a scientific study, research study conducted in Germany, published in ESCAP in 2021. Colleagues from Hamburg, Johannes Hebebrand, lead author. This was based on a nationwide population-based study conducted between May 26 and June 10, 2020. Obviously, time is crucial in these studies because you have to, in parallel, look at the restrictions in the respective country if you want to know what was going on at that time. In Germany, during this time period, partial lockdown, schools were closed, leisure facilities, and most stores closed. They invited about 3,500 families, with children in the age range 7 to 17 years, participation rate somewhat below 50%. Self-reported self-reports as of age 11, and the parents provided information for all children for the total age range. The weighted data indicate a representativeness for German population. However, it's crucial to realize that many studies in this field are not really truly representative because the comparison data prior to the onset of the pandemic and the current data are not really comparable because mostly different samples were analyzed. So what the authors did in this situation was to compare the recent data of the COPC study to population-based BELLA study conducted in 2017. The children and families were recruited based on a similar methodology. As you can see, 1,500 families. Next. This is the results for health-related quality of life in German children and adolescents before and during the pandemic. As you can readily see, this is rated substantially higher, or the health-related quality of life has gone down during the pandemic, compare the look at the low health-related quality of life, and you can see that actually this has gone up threefold or almost 3.5-fold. This is happening in girls and similarly in boys. So a very clear-cut evidence according to this study. Again, like to point out that the data are not exactly comparable, not the same people or kids being assessed, but nevertheless evidence for a effect on health-related quality of life, a substantial effect. Next. So 70% felt burdened by the pandemic, 65% found homeschooling and learning more difficult than before, 83% reported fewer social contacts, 39% impaired relationships with friends, a quarter about reporting more arguments in the family, and 32% of the parents reported that disputes escalated more frequently at home. Next. Let's look at the impact on mental health. They used the SDQ to assess mental health with its 5 scores, 5 scales here. And so we have the total problem, we have emotional symptoms, conduct problems, hyperactivity, and peer problems. And in boys, you can see that basically there's been a worsening in all, both in the total score, but also in each subscale score. So there's quite a, if you look at the rate of normal children ranked normal prior to the pandemic of about 81% dropped to 66% during the pandemic. This is the boys. Next slide shows the girls. Again, if you look at the number with total score in the normal range, 83.4% drops to 73.3%, indicating again a substantial drop. Interestingly, the emotional symptoms in girls did not reach significance, and the conduct problems just basically achieved significance. And again, peer problems, interestingly, also not achieving significance. Next. Now, a somewhat more sophisticated study, I would say, is the or maybe more more representative would be the Youth in Iceland study. This is a study that is done every 2 years, includes all 13 to 18-year-olds in Iceland who attend school. So the survey was conducted in 2016, in 2018, and in 2020. Note that there's a change from spring in 2016, 2018 to the fall in 2020. And for the 16 to 18 years old, it was continuously conducted in the fall. Obviously, there were slight methodological differences, particularly pertaining to the fact that in 2016, 2018, teachers distributed paper-based questionnaires to students, and in 2020, teachers gave links to complete the electronic survey, and that there were strict physical distancing mandates around in November 2020 with no more than 10 people allowed to gather. Most secondary schools limited to online teaching. Children under age 16 continued to receive on-site learning in school in Iceland at the time. Next. So what this shows you is for depressive symptoms and mental well-being, there's a clear-cut indication that depressive symptoms have increased. The green crosses represent the most recent data, and you can see the other crosses, the blue and red, are close together, 2016, 2018. Mental well-being scale, the bottom part here, again, you can see a drop in mental well-being in boys and girls and in total. Next. The proportion of participants with high depressive symptoms increases basically also in relationship to age. It mostly affects the older children, not as much the younger children, despite the fact that throughout basically the green bars at the latest years, 2020, tend to be the highest, indicating the highest percentage of children with high depressive loading. Next. It should be pointed out that not everything is getting worse. So if you look, for instance, at cigarette smoking or e-cigarette use or even alcohol intoxication, actually 2020 was an excellent year because everything has gone down. Next. To continue, I would briefly like to point out that COVID-19 can have very acute effects. The pediatric acute-onset neuropsychiatric syndrome, just look at the very bottom, PANS, post-infectious autoimmune and neuroinflammatory events. So it's a sudden onset of obsessive-compulsive disorder or a severely restricted food intake and concurrent neuropsychiatric symptoms and motor dysfunction. I think it's important that child and adolescent psychiatrists know of this acute manifestation of a COVID-19 infection in children and adolescents. 2 case reports been reported in Lancet Child and Adolescent Health just recently. Next. There's also clear-cut evidence that COVID-19 is related to an increased occurrence of mental disorders. Those who have had COVID-19 are at increased risk. And as you can see here, this is a risk that occurs within 14 to 90 days. These are adult data, and the risk is increased versus 6 other major health events. Next, please. To just get if you compare the upper bars here, if you compare with influenza, you can see that COVID-19 is increased, has led to a substantially higher rate of mental disorders, depressive and anxiety disorders. Next. So these are bidirectional associations. The contextual factors are alone are insufficient to explain differences in psychiatric sequelae. They are not readily explained by differences in illness severity. There is clear-cut indication that patients who required inpatient treatment have a higher rate of mental disorders, but apart from that, there's no clear-cut indicator that severity really matters that much. The diagnosis of psychiatric disorder in the year before COVID-19 outbreak is associated with an increased risk of 1.65 of a mental disorder after a COVID infection. Next. This is my last slide. Also, I think it's important for you to realize that fatigue is a potential symptom that we will be seeing more frequently in the future. Also, fatigue as a consequence of a COVID-19 infection. And again, independent of the severity of the initial infection, according to this study, again, adults, 50% of the people who had had a COVID-19 infection reported fatigue at a median of 10 weeks after initial COVID-19 symptoms. There was no indication of a relationship between severity of the infection and the occurrence of fatigue. And there was a clear-cut indication that the female gender is more frequently affected. To conclude, I showed you that there are general population data indicating an increase. I showed you the experiences of child and adolescents, heads of departments of university hospitals for child and adolescent psychiatry, also suggesting that there's an increase. I went on by pointing out that COVID-19 can be a risk factor for the development of mental disorder, with mental disorders occurring prior to the infection also representing a risk factor. And I briefly went into the acute manifestations, neuropsychiatric manifestations of COVID and the ensuing fatigue that occurs about 10 weeks later. Thank you very much.